Whether at home, work, play, or just out and about, germs are everywhere, and they can get onto your hands and items you touch. Here at VA Palo Alto Healthcare System, leaders are paving the way to inform veterans, their families, employees, and community residents that clean hands save lives. The phrase is appropriately dubbed as the medical center's year-round hand hygiene campaign to spark awareness that hand washing can greatly reduce the possibility of healthcare-associated infections, or HAIs.
Once you wash your hands, you're not transmitting things. You're not carrying things from one patient to another.
Gloria Martinez, nurse executive and associate director for patient care services at VA Palo Alto, leads the medical center's HAI prevention efforts. What is the VA Palo Alto Healthcare System doing in this effort?
So we have our own HAI reduction meetings. We have our own special teams of secret shoppers to go out and observe people. We have our hand hygiene monitoring that's going on. We have our hand hygiene education that's going on. We have a robust program of ensuring we have the soaps and the towels and things like that. So that
HAIs can affect about 1 in 21 hospital patients in the United States on any given day. But practicing proper hand hygiene is one of the simplest ways to reduce the problem.
We take it very seriously.
Army veteran and VA Palo Alto Director Thomas J. Fitzgerald III says hand hygiene is a top priority at the medical center.
Yeah, so this facility in VA thrives upon psychological safety, and we want veterans to, again, be an active partner in their health care. So if your provider who works for you is not doing what they're supposed to do in regards to washing their hands, you have every right in the book to ask them to wash their hands. And no provider, no employee should have a problem with that, starting with me.
According to the Centers for Disease Control, studies show that hand washing can prevent 1 in 3 diarrhea-related sicknesses and 1 in 5 respiratory infections, such as a cold or the flu. What type of soap should you use? The CDC says bar soap or liquid soap. Studies also show that there are no added health benefits from using soaps containing antibacterial ingredients when compared to plain soap. Both are equally effective in getting rid of germs. And if soap and water are not available, use an alcohol-based hand sanitizer that contains at least 60% alcohol.
understand where your hands touch, understand where your hands grab, understand what your hands, gather or hold onto during the day, and how important it is to, on a regular basis, cleanse them off.
So, what's the right way to wash your hands? There's a right and wrong way, and simple motions can make a difference.
Sometimes when people go to wash their hands, is they put their hands under the water like this, get soap, and do this, okay? And then they rinse off, and they're done. And when you think about that, they haven't done in between the fingers, they haven't done the tips, they haven't done the thumbs, and they haven't done the backs. And it's really important that you do the entire hand.
We have to wash our hands. We have to make sure that we are helping veterans heal and helping them thrive and not just survive.
For more information on hand hygiene and how you can help, visit us on the web at paloalto.va.gov. Kim Betton, VA Palo Alto Healthcare System, U.S. Department of Veterans Affairs.